Hey, it's Dr. Jaban. So today I was having a conversation with the nutritionist in my office about pans and pandas. She said, I don't get it. Why is it that one kid gets pans and another doesn't? What makes strep so reactive for one kid, creating all of these symptoms, but not for the next kid? Or Lyme or heavy metals or toxins, why is it a trigger for one person and not another? Well, whether it's an adult with Lyme disease and mold reacting when their spouse doesn't, or a kid reacting where his brother didn't, even though they both got strep at the same time, there's a lot of underlying causes that you have to think about, and it's never as simple as just one. So I wanted to talk a little bit about this because she wasn't super familiar with pans and pandas. And if you're not, it's a pediatric condition where there's a autoimmune flare that results in inflammation in the brain in a kid, leading to a tremendous number of symptoms, just a few of which are tics, whether they be physical or verbal, OCD, loss of handwriting, irritability, raging, so many more. That's just a few that I wanted to get started with. But some of the things that I think about and that I see patterns in with kids that are having all of these behavioral issues, and so many people are not diagnosed, by the way, that have them. So if you know someone who at a young age started having OCD, started developing antisocial behaviors or irritability, anger, sensitivity to touch, to socks, to clothes, after they got sick, or even if they don't remember getting sick, but just somewhere after they felt very normal in life, something just developed. They go, well, maybe at 10, this just started happening to me. That could be pandas. We don't know what happened to them if they didn't get diagnosed back then, but today it's becoming a much more common diagnosis, not common at all, but more than it was when I was a kid. It wasn't even a thought. So what is going on with this? Well, just like with Lyme people or with parasite or mold patients, you have to be susceptible. So if you get a strep infection and you beat it and you move on, that doesn't mean you're going to get PANS as a kid. If you get Lyme as a kid, that doesn't mean you're going to get pandas. It doesn't mean that you're immediately going to get it. What happens is your bucket, your body, your ability to adapt has to be overwhelmed in some capacity. You have to have either a genetic predisposition that doesn't allow for you to detox, possibly. You have to have an overabundance of stressors that have weakened your body, creating a immune system that is going to flare when one trigger happens. So much like an army storming the beach, your immune system is similar. So if you have just a few guys on your beach and you're trying to defend this big invasion, you're not shooting at one thing. You're shooting at everything that's coming on, just hoping to hit something because you don't have time to aim. And if you allow your immune system to reach that point, then adults call it autoimmune diseases. Kids, we call it pans and pandas if it relates to the brain, right? So an adult can have symptoms that are similar, that are depression, anxiety, from infections and toxins. But in kids, we're seeing pans and pandas come up because you're seeing testing slowly being developed that shows this autoimmune encephalitis, so inflammation to the brain from the immune system. Now, I have seen siblings where one has PANS and the other doesn't, and they've had the same infections. Well, why is that? Well, when the mother gives birth to the child, the mother actually will give whatever's in their body to the child. So if the mother's first child gets the most of the toxicity out of the mother, and then the next baby, well, maybe she started eating cleaner, or maybe she simply just got rid of a lot of that toxicity out by creating her first baby, then that susceptibility might be higher in the first baby. Now, if it wasn't from birth that you got the toxicity, what was the behaviors or the household that you were in that first child was in that maybe the second wasn't? So I'm just giving ideas of some things to think about. Also, what schools did the kids go to? Did they have mold? Did they have a craving difference? So did one child eat a lot more carbohydrates or not? Did you have a different animal in the home that could have passed along infections, licked one child in the face or not the other? Did you give more or less different immunizations? That's another piece of the puzzle. Did one kid get hit with multiple infections at once or back to back to back that created this immune flaring that the other didn't? So as we were discussing the potential reasons why PANS and PANDAS happens, it really comes back down to how full is that kid's bucket on stress and stressors? Did they come from the environment, from passed down through being birthed, or was it some sort of infectious reaction where the body was just overwhelmed immunologically and it was a trigger? Now, all of these questions don't necessarily change the fact of your kid has PANS and PANDAS. It's just something that was interesting that she was curious about, as we are dealing with in my clinic so many kids that have these reactions and she wasn't used to it. So it was just food for thought. So if you have a kid dealing with depression, anxiety, if you have an adult that has been dealing with it since childhood and they don't exactly know why, so there was never a psychological assault of any kind, it might be worth looking back and going, did this happen? Was there a possible infection? Talk to their parents. A 23-year-old called in today that has had depression and anxiety since she was a 10-year-old. And I go, did anything happen around there? Nothing she could remember, but she definitely seems like a candidate to have parasites with the digestive trouble that she has now. So I'm wondering if maybe there was an infection that happened back at 10 that has led to today's depression and anxiety. So just kind of something to think about, something to consider, to add to your own knowledge about potentially what's happening in your health. I hope you all enjoy this video. I hope this creates thought, because for me, it's constantly analyzing and trying to understand what's happening to the people that I work with, trying to help them to understand so that they can take control of their own lives and their own health and move forward in their healing journeys. Thanks for watching, everybody.